So a very good morning to all the audiences present here, the students who are trying to seek the admission into the B Pharmacy course, the students who are already into the graduation doing from our institute, and those who still have the queries in their mind. So we here at the Lloyd Institute of Management Technology are conducting these webinar series, and today is the webinar 3 on the title Growing Opportunities in Pharmacy Profession. I welcome the speaker of the day, Mr. Avinash Mohanty, Vice President, Strategic Partnership. A very warm welcome, sir.
Thank you, Dr. Kumar.
Yeah. So kindly accept this floral bouquet from our side on the virtual platform.
Thank you. Thank
Yeah.
you.
Yeah. So before do I have the your talk with the audiences, I would just like to mention a brief snapshot of my institute, that is Lloyd Institute of Management Technology, with your permission, sir.
Yeah, please.
Yeah. So our institute holds a vision to become a globally recognized education and research organization in the field of pharmaceutical sciences and produce the quality professionals to contribute to the well-being of the society as well as the growth of pharmaceutical industry. So for your kind information, Lloyd Institute of Management Technology was established in the year 2004. And after successful 2 UG batches, we launched the post-graduation program in the subject of pharmaceutics. Thereafter, in 2011, we initiated MPharm in quality assurance as well. In the year 2016, Lloyd started the first time Niyukti, that is the job mela or the grand Lloyd Job Fest, where basically the students across NCR and here the region, the job seekers, they come to this common platform where the industries are also there on the board and the choices are made as per the students' caliber. So this is a very grand event and a landmark event in the Lloyd scenario basically. In the year 2018, we got the recognition from the NBA, which is basically a milestone for the Indian educational institutes, which landmarks the quality standard for the technical education in India. And in the same year also, we had the collaboration with the DIPSRU, that is the only pharmaceutical university in India, and for the research and academic purpose. And the process is still going on of the excellence. And the year 2020, last year, we started a diploma in law and pharmacy, the amalgamation of pharmacy as well as law, under the National Skill Qualification Framework, Ministry of Skill Development and Entrepreneurship, Government of India. In 2021, we had been declared as an established approved research center for carrying out the research by the Dr. Abdul Kalam Technical University. We have also been the recipient of the award for the best pharmacy college in Uttar Pradesh for outstanding and exemplary contribution towards education. And we have also started MPharm in the third subject, that is MPharm Pharmacology. So recently also we are going under the various collaborations with the different research institutes, and we are very sooner about to start the forensic sciences program also. So this is our journey and some of our milestones and many more years to come. Lalit sir, I would request you to kindly mute yourself, please. Yeah, so these are some of the pictures. Like we have the sophisticated analytical instruments lab where the projects are going on and the research team is involved with the projects come from the company as well. Like we have been engaged with the dermatokinetic studies also, and we have also been given the ModDrop account from the AICTE under facility, and we have established our drug designing lab, which is equipped with the software Ligand Scout. And recently, we also got the DSIR approval. So Lloyd Institute of Management Technology is now DSI recognized, which is again a recognition given by Scientific and Industrial Research Organization by the Ministry of Science and Technology. So some of our USP that we are NB accredited. We have the academic and research collaborations, skill development programs are going on. We have the DSI approval and Niyukti Job Fest, which is a known event in the colleges around, which happens to be every year in the month of March to April. We have also the certification ISO 9001-2015 for our analytical and research facility, and obviously all because of this competent and talented faculty. And no wonders because of our mentor and our guide and our group of institution, Dr. Vanna Arora Sethi. I'm just sorry, sir, she could not manage to join today. She had been really a busy schedule today. So now I told about my institute, and for the audience's information, I would like to give a very brief profile of today's speaker, Mr. Avinash Mohanty. Sir has a rich 28 years experience, and he is basically an accomplished marketing leader with diverse experience in portfolio customer marketing, strategic partnerships, sales management, key account management, learning and development across therapy areas. And this is just of the few of the 67 diversified areas he has already, had an experience with. He has done many diplomas, and the major is like advanced program for marketing profession from IIM Kolkata after his MSc. He had been in the project of the pneumonia mortality reduction in collaborating with Clinton Health Access Initiative and Ministry of Health, Abuja, Nigeria. He has been looking after various workshops organizing for the key accounts management. He has been involved in the product of the BioPatch launch. He has been the recipient of the IPTC award, that is Innovation, Performance and Trust Award, which is the highest prestigious award given to the GSK employees by the CEO themselves. So it is a very achievement of his, I mean, a big achievement to quote here. Out of few, and he has a global recognition award for customer engagement, and he has also been recipient of the outstanding performance trophy in the year 2018 for artificial intelligence and other 4 global recognition award. So this was just a brief I had given. Rest, my slide was actually getting filled, so I just could not manage somehow. So here is our speaker of the day. So Avinash sir, I welcome you on behalf of my institute, and over to you, please.
Thank you, Dr. Kumud. Thank you very much for that intro.
Okay. Thank you, sir.
So am I audible? Because I think some of them are mentioning that we are not audible to them.
No, you're quite audible, sir. Can anyone also just confirm, Chitra ma'am and Lalit sir?
Yes, ma'am, audible, sir. Audible, sir.
Yeah, I think you are audible to me as well. Yeah.
I hope you can see the slides, sir.
Yeah, I can see the slide. Not complete. Yeah.
So,
should I start my video also, or it's okay?
Of course, yes. Like the interaction would be more,
Okay.
Please let me know whenever the slides are to be turned. I'll be here at your end.
Okay. I think some 85 and maybe, plus minus 7, 8. So around 75, 76 people are there. So welcome on board, everybody. Let's make it very interactive. I think, the success of this particular presentation will depend on you and not on me. I do have a, good experience in terms of number of years, but the best comes out when somebody asks questions. Then we know that, from our experience that, yes, we are able to answer many questions. So friends, I mean, be candid enough in asking as many questions as you can. That is the essence of this presentation. I have tried to make it less and less, kind of Google things. It's not searchable. It's about my experience. It's about how people should be sensitizing themselves towards the career that they want to choose. So that is the premise of my presentation. Dr. Kumud, next slide.
Yes, sir, please. Just give me a sec.
I think what I'm showing you is very, very dear to me, I remember distinctly year 1994, around January, I was there in Mumbai. 92, 93, I passed out my MSc. I topped my college and I didn't know what to do. So somebody told me that, there is an organization called GSK. I mean, at that time, it used to be Glaxo only, Glaxo India Limited. So they said there is a role called medical representative and you can apply. But when I started applying, many of them, they said, no, I mean, you have topped this college. Why don't you go for research and all those kind of things? And I was confused. I didn't know what to do. But finally, I gave in. I went to the interview, was selected, came to Mumbai. So this 29 years back down the lane memory that I'm telling you is of that Mumbai hall. I distinctly remember. I met one of my mentors, Mr. Kashyap. He was the senior general manager at GSK at that time. I'm talking about some 30 years back, 29 years back. Now, as because I didn't know anything about what a medical rep is all about, and in fact, I didn't know anything about pharmaceutical companies as well. My interaction was, my interface with all these things was, I had some medicine, some point of time, that's it. Once or twice I visited some doctor, that's it, Even doctor visit used to be very, very less, till that time. So I asked somebody, okay, this particular gentleman, the senior manager of Glaxo, he started as what? Because I was confused about my career. People said, you might not be doing the right thing by joining as a medical rep because you have taught the college. There are so many things you can do. Why choose this? And therefore, I wanted an answer for myself. So I asked somebody, who was with GSK, with Glaxo, in fact, India Limited at that time. Now only it is called GlaxoSmithKline GSK. At that time, it used to be Glaxo India Limited. So when I asked somebody, and he said, the senior general manager, the senior professional, started as a medical rep only. And I don't know, all of a sudden, I felt very happy about it. I said, okay, if I do well in what I've chosen, I can go up to become maybe a senior general manager like him. Of course, Mr. Kashyap was one of the most loved, senior managers in GSK. He retired as executive vice president, and he was the first executive vice president in GSK, in fact. So, friends, I got an answer. I started thinking about what I can become in future. And that all of a sudden was very, very important to me, right? And therefore, I would like to relate this story with you. While I was a, MSc topper, you have kind of, you have multiple choices. And here you have chosen to be from, a sector called as B pharmacy or pharmacy. Let's take pharmacy. So what is the correlation, So like I looked for somebody, if I start like him, can I become like him? And therefore I had my answer. And today I'm also a vice president and I'm happy about what I have done with my career, right? Likewise, do you have, some icons whom you can look forward to, who has started the way you are going to start? So therefore, I wanted to show you some more pictures, Dr. Kumar, if you can
Yes,
go to
yes,
the
sir.
next
Yes,
slide.
yes, I'm there. I'm sorry.
So here are two icons from the industry. One whom I know very, very well. He has been again a mentor for me for a long,
Sridhar.
long time. Mr. Sridhar Venkatesh. He is the managing director currently of GSK India. And the second person I'm showing here is Mr. Pankaj Patel, who is the chairman of Kedla Healthcare. Now, friends, why I'm showing you this is because of two reasons. Mr. Sridhar Venkatesh grew in a middle class family. His father was also into, pharmaceuticals only. In fact, he was with GSK only. Mr. Sridhar Venkatesh started with something else. Now, he chose to, take pharmacy as the course he was interested. He enrolled himself in B pharmacy. Then he did his M pharmacy, right? Then he did his MBA and the likes. Now, he chose because he wanted to be in pharmaceuticals and B pharmacy was an obvious choice, right? Whereas Mr. Pankaj Patel could have done anything that he liked. And despite that, he chose to do B pharmacy. And he also is a B pharmacy and M pharmacy and many other qualifications that he acquired, going forward in his career. Both of them today head organizations, billion-dollar organizations. Mr. Sridhar Venkatesh, I know him for a long, long time, is a much loved, respected, industry veteran. We have learned a lot from him. And that thing happened when he started doing his B Pharma, M Pharma. At that time only he was clear about what he wanted to achieve. So sky's the limit when somebody decides that, okay, I want to be in this field and I want to explore everything that this field has to offer to me. And so is the case with Mr. Pankaj Patel. So therefore, do we have icons to follow? Multiple. I mean, these are just two examples that I'm showing you. You go to my previous organization, GSK, and the floor is full of people who have started as B pharmacy, then they have done other courses and all, right? That is the kind of, diversified roles that this particular field offers, which is pharmacy. And therefore is a very, very respected one as far as all, us pharma professionals are concerned. I'll tell you one more story, So my first posting was at a place called Patna. And I was working and it was very tiring, hot summer and you go and work and you get tired and some of the interactions are not very good. So again, you start asking yourself, am I doing the right thing? Yeah, I've taught my college. I could have done this. I could have done that. So what is that I'm getting out of this? And then I met this doctor who told me about a person called Mr. Rao. He was a also a medical rep, a very senior, very respected medical rep at Patna. He was a South Indian. He was working at Patna. Now, this doctor was wanting to know if I can find a house for him. I said, why? Why you are trying to find a house for a medical rep? You never said the same thing to me. Now, this doctor told me about Mr. Rao. He said, this Mr. Rao is a B Farm and M Farm. When he comes and interacts with me, it's a different day for me because the level of interaction is very different. You cannot compare him, with other medical reps. So while everybody might be, many of them might be medical reps, but the way he interacts, because of his background, in pharmacy. So the background that B Pharmacy and pharmacy in general offers you is very different. It aligns you with the requirements of pharmaceutical space, which is very, very important. Therefore, friends, in my current role, where I'm a vice president at Medisage, which is a health tech organization, I just activated my entire UP team. We have taken 70 people there. Trust me, all 70 of them are B Pharmacy. And why do I do so? I could have taken graduates as well. I didn't bad at all. I have not done bad. I was not a B Pharmacy guy. So why I chose to, start with B Pharmacy graduates to begin with? Because I want to create a equity, UP is a state where we are starting, where we are activating our entire team. I want that communication to remain very scientific. I want professionals to go to the doctors community, and the level of interaction, level of discourse that happens should be of high class. That is why consciously I have chosen that everybody that I'll take has to be B Farm, because I'm starting, there. I'm setting a premise there. I'm setting my base there. So that is the type of importance that pharmacy has for pharmaceutical, industry. Next slide, Dr. Kumar.
Yes, sir.
So now, what makes it so lucrative, why everybody, you see around yourself are mostly from B Pharmacy or M Pharmacy, is because it is the most diversified category. Just see the type of roles that it offers: clinical research and development, drug quality control and analysis, drug production and manufacturing, pharmaceutical sales and marketing, which itself is so big that I might be requiring, 5-6 hours of session to tell you about pharmaceutical sales and marketing. But today I understand the role is not that. Today it is about sensitizing you about certain important aspects, okay? So that you get the clear picture, so that you can be part of a wonderful ecosystem. And then you can go into pharmaceutical education, you can go into drug control and inspection, you can go into hospital sales, you can go into, what is that, multiple research things. And when I sit in my floor, I used to sit in my floor at GSK, right from regulatory, right from, not even only regulatory, obviously everybody was, from pharmacy, but even logistics and all, even they were from pharmacy, because their understanding of this whole concept is very high, right? So if you see something which is completely aligned with the requirements of pharma industry, it is pharmacy, and that subject called pharmacy, and the students called B Farm and D Farm and M Farm, of course. Next slide, Dr. Kumar. Now, what is at the core of healthcare ecosystem? And this ecosystem word will come again and again. This is the crux of my presentation today. And I would like you to be sensitizing yourself towards this ecosystem called healthcare ecosystem. Now, there are 3 core to this: patients, doctors, and drugs. You might be thinking, some of you might be wondering, there are so many other things which forms the core of healthcare ecosystem. Why I have not mentioned them? Why I have not mentioned hospitals? Why I have not mentioned governments? Friends, everything that the society does, everything that the government does, everything that the hospital does, everything centers around these 3 core of healthcare ecosystem, which are patients, doctors, and drugs. Regulatory things are because of drugs. Monitoring because of drugs. Monitoring because doctors, how they perform, what they do, whether they are doing the right thing or not. Patients, because everything is meant for the patients. So providing a comprehensive healthcare, these 3 are the pillars. Now it's our ability to think before and think beyond these 3 pillars that will enable us to be part of this ecosystem and comprehensively, create something which is going to help this ecosystem. So, but talking about India, coming back to Indian scenario, Indian healthcare landscape, We have created multiple records during Corona time, during the pandemic time. We have completed 2 crores of vaccination and all. And that calls for, a lot of commitment on part of the government. We have a very efficient, kind of government, which is very good at execution, and that they have run a very successful program. However, they do, whatever they do, will it ever be sufficient? Today, Corona has come, tomorrow something else will come. What we will continue to have every time is we will have patients. To treat those patients, we will always be requiring those doctors, and doctors will always require drugs. And all of these will coexist all the time. And therefore, to kind of support them, the most important category that will always be required and in multiple formats is the role of pharmacist. Because whatever they do within the ecosystem, in everything that they do, you will see, pharmacy graduates, pharmacy students intervening in everything. Might be, when we talk about Corona, we talk more about doctors and the likes. Okay. But what role pharmacy people have played, that everybody knows today. Of course, you have to be insider into and part of this ecosystem to understand what is their role. What I'm trying to imply here is, come what may, I mean, today, 50 years back and 50 years hence, this space is going to remain relevant forever and ever and ever, because these three things are always going to remain there. And therefore, the entire ecosystem, which consists of the pharmacy as well, will always remain relevant. Now, friends, affordability and accessibility will always plague healthcare, and that too for a developing country like India. How do you think we can fulfill this? What is the government endeavor? How some of the countries where these are beautifully placed, this ecosystem, what they do, in fact, what they do. Unlike India, where doctors do everything, you go to a PHC or a CHC, which is community health center, and you just see, you go to a medical college. We go day in and day out to medical colleges because we have multiple projects running in medical colleges. You see any doctor, out of 24 hours, the fellow must be working for 17, 18 hours. Out of 17, 18 hours that he works, around 40 to 50% of his time, he is doing something which somebody else can also do. Just because of lack of manpower, they are forced to do certain things, which is not as per their, education, not as per their training. So are they working at the top of their license? No. Can they? Yes. If the government kind of changes its policies, have more people, have more professionals. Who are these professionals who can chip in? The next in line is pharmacy. And healthcare systems, when it is very robust in some of the countries, is only because doctors are supposed to do what they are best at, which is treating patients. Now, treating patients includes a lot of things. Multiple of the things are done by pharmacists. Okay, of course, that is clinical side of it. And there are multiple other things. So what I'm trying to tell you is, if somebody thinks of the entire ecosystem, they have a great role to play that only will allow the doctors to work at the highest qualification, at the highest level of their license, which is a very, very important thing. That only will ensure that despite affordability and accessibility being a challenge in a country like India, it can still be fulfilled if somebody who is available. We have plenty of pharmacists in India who currently are doing a very transactional job. What is that? Transactional job? Meaning, when you ask somebody in the society, what is pharmacist? And most of them will end up saying, okay, we go to pharmacies, we show them a prescription, and they fulfill that prescription. Yes, that's a very, very important part. That will always have its importance. But there are multiple things that pharmacists do. And for that, I would like you to be, kind of sensitizing yourself around the entire ecosystem that exists around you, right? So affordability, accessibility, if this has to be achieved in a country like India, complete sensitivity of the ecosystem, commitment on part of the government is very, very important. Therefore, friends, going forward, if you are part of this pharmacy, this wonderful thing called pharmacy, you will have multiple roles to play. Is my single point submission today. And I want all of you to ponder on this very, very important thing. How can you do that? When you think more about this ecosystem, if, for example, today time is less, had it been a 2-hour session, I could have asked 10 of you at least, what exactly I mean by this ecosystem. And you'll be surprised at the variance of answers that I'll get from all of you. So if all of us are on the same page and all of us are capable of thinking what has happened in the past, what is happening currently, what is going to happen in the future, what are their differential needs in terms of patients, what are their differential needs in terms of doctors, how drugs should be developed, what are the new drugs that is required. All these things will entail a lot of involvement from the pharmacy and the likes, right? So that is my submission to you today. Next slide, Dr. Komod. Yeah.
Yeah.
So can, like I was telling, and further to that, can pharmacy professionals be the solution? I think yes. Do you have a role to play in research? Plenty of them. Do you have a role to play in academics? Yes, of course. Do you have a role to play as a pharmacist? Yes, of course. Do you have a role to play pharma marketing? 80% of your role is there only. And you do 80% of pharma marketing. I mean, not your role as 80%, but in pharma marketing, 80% of successful people are from your field only. Hospital administration, full of people from pharmacies. Inspection, monitoring, government side, yes, it is full of, pharmacy sides. So everywhere you see, which defines the landscape in India, it's about pharmacy people all around. So success lies in providing omnichannel experience to this ecosystem. Practice at the top of your license to create maximum value, expand access, improve quality, and lower the cost. Who can do this? If again I depend on the doctors only, no, it's not achievable. If at all it is achievable in a country like India, pharmacist has to play a very, very big role. Some of them has already seen this, some of them has already experienced this, some of them have thought about this entire journey, and therefore we have the likes of PharmEasy and many other innovative solutions, right? You all got to be thinking like that. But the basic ingredient of your learning should happen when you join a course like this. Then only it will give you the right platform, it will set the right premise to be part of this ecosystem where you can innovate further, right? Next slide, Dr. Kumar.
Yes, sir.
Now, out of all the things that I have shown you, I wanted to give one example of what is enabling omnichannel experience, which I'm emphasizing again and again. So two things I have told you is, one is, say, for example, pharmacies of tomorrow, okay? And the other I'll give is maybe a marketing example. I'll like to substantiate that with my own company, own organization, which is Medisage, which is a health tech initiative. Now, till it remains transactional, till it remains a prescription will be shown to me and I will fulfill that prescription. Again, I'm not kind of, giving less importance to that very important role. That's a very, very important role. Just imagine a wrong medicine going in somebody's hand, what havoc it can, create. So it will always remain the most important, role. Having said that, should it be limited only to that? Or is it allowing pharmacists to work at the top of their license? I think no. They can think much beyond. They can think about the entire patient journey. When it started, what is the history of this, family, what it is currently facing, what kind of challenges this particular, family faces, what is the implication of this particular patient's, illness to his, family. Can I address all of them? Can I give them a time schedule? Can I create an app for them? Can I provide them some innovative solutions so that their overall life becomes much better? And then we talk about health and wellness. It is not talking about, fulfilling a prescription that has been shown to me. And I would like all of you to be sensitized towards those things. And when you can do this, when you see when pharmacists see somebody coming to their shop and they start imagining what has happened to this, patient, what might be happening in his family, what are the hurdles he may face going forward, what his life will be like. I think you have already started thinking about the entire journey, and then only it will, you will set the genesis of thinking innovative solutions. So guide them on their journey back to health. Be a resource for health information to them and their families. Use technology for health information and counseling. Be the destination for healthy pharmacy. One should not think about this pharmacy and think only about a medicine being given to him. He should go there with a comprehensive solution for all his kind of, wellness issues, wellness problems. Okay. And it should be a solution center, it should be a solution center for sick. So they should see this as a solution to all their ailments, all their problems. Then only it will be a comprehensive solution. Then only it will allow the pharmacy and the likes, pharmacists and the likes to, like I said, work at the top of their license. Meaning they'll be working for what they have been trained. They will not only be, doing a transactional thing like fulfilling a prescription, right? Are you all with me? I mean, any questions or any observations, anything you would like to, ask me at this stage? Of course, we'll have a Q&A round at the end. Yeah, anybody? You can unmute and you can say something.
Anybody who has a query can put in the chat box or ask. Or maybe we can have at the later stage, if not as of now, sir.
Fine. Okay.
Yeah.
So the second, so this example I gave you was from, somebody who's managing a pharmacy, what somebody can think beyond, how somebody can think beyond, right? So therefore the answer was health and wellness. And how can he do that? When he enables that omnichannel experience, okay, by his thought process, by his experience of the patient, by imagining the journey of the patient. Now, second example I would like to give you is, enabling omnichannel engagement with HCPs. And how to do that? So, for example, in pharmaceuticals, in pharma companies, what we do is we interact with the HCP community. HCP means healthcare professionals. We interact with them day in and day out. Now, you map 10 organizations where everybody has to interact with doctors because that is at the core of healthcare, like I said. Now, everybody will give a different experience to the HCP community they're interacting with. So only saying that sales and marketing will not suffice. Whoever is able to engage the HCP community holistically, whoever is able to imagine the entire journey, whoever is able to map all their requirements, all the gaps that they face, okay, in treating their patients and maybe whatever role they have, they only will be successful, right? So therefore, while sales and marketing team will be there in every organization, but the success, if you measure, it will be different for everybody. Why? Because some of them are only capable of enabling this entire journey, okay, which they are trying to provide to the doctors community, the HCP community, and therefore they are more successful vis-a-vis some of the other players in the same market, right? Next slide, Dr. Kumar. So enough, I have, talked on this omni-channel experience and how to enable that. Now, see, you all are at different stages, some of you are still to kind of, start your B Pharmacy. Some of you might be already part of B Pharmacy. Somebody might be thinking of, joining something, maybe, on the verge of doing a job or maybe something, some other course, some other academics. Now, this particular slide is agnostic of that. It's not that because you are part of a job, therefore you will be requiring this slide. You are yet to start your B Pharmacy, so this is not relevant to you. This is like they say, lifestyle modification. This about also is a modification in your thinking process, right? So this starts in everything. You can imagine your, brother doing something. You can imagine your family members doing something, and you just try to go back and go forth into their journey, and you will get some solutions. That is the beauty of this particular thing that I'm mentioning here. So how to do that, how to achieve that? And again, let me reiterate that it has to be relevant to you, irrespective of what you are doing. You just have to internalize it a bit, right? So understand the entire journey of whoever it is. If it is a doctor, you have to understand his journey. If it is a patient, you have to understand his. If it is a pharmacy, what all they do, what all they can do, all those kind of things, right? Minutely understand the gaps. Now, one request from my side is when you go back now, just try to, apply this to anything that you are doing. This is applicable to everything that we, face. So minutely understand the gaps, do primary research for further understanding, because everybody will have a different implication, of the things that they see. So do some primary research to get into something which is more concrete, right? More fact-based. Get your stats right, okay? Get your statistics right. Zero in on the addressable gaps. So there might be 10 gaps, you will not be able to address them, all of them, which is addressable because you have limited resources. With the limited resources you have, what all the things that can be addressed is what you have to find out. Have an executable plan, leveraging all channels. Now, when we used to do this, some 10 years before or maybe 5 years before, it used to be a very different thing. Like, for example, when medical reps go and meet doctors, it only used to be a face-to-face interaction. While it is still one of the best things face-to-face, because that tells you a lot of things. I mean, after all, human is a set of behaviors. And when you deal with that behavior, face-to-face interaction is very, very important. But now multiple things are available. So you can provide experience to the doctor, which is very, very different. And therefore, leveraging all the channels that are available is the key to all the problems that we have in the society today, including the healthcare. Then you got to organize the multiple elements that you have chalked out. And finally, monitoring and feedback. Some of you can take note of this. This is going to remain the sequence in whatever you do. This is like a life mantra, okay? Or maybe an execution mantra in whatever you do. Going forward, you will be doing a lot of projects as part of the course that you will be doing. Going forward, when you will be doing jobs and all. Again, these things are very fundamental, and this will remain the fundamentals of how things should be approached. So, provide people what they need, when they need, where they need, and how they need. I think these are very, very important. If you're able to answer these things, I think you are providing them a comprehensive solution. And that was the essence of my presentation today, which is enabling omnichannel experience and sensitize you into thinking omnichannel before embarking on any project. Yeah. Next slide, Dr. Kumar. A brief, kind of introduction of what we do at Medisage. It's a health tech organization. So friends, 29 years in pharmaceuticals and only 6 months at Medisage. Still, every single day I have enjoyed. Why? This truly is providing me that omni-channel engagement with HCPs, which I always wanted to do, but I found some limitation in pharmaceuticals. Here, I'm in a position where I can engage all of them, all of the resources that is available to me, and provide experience to the HCP community with whom we deal day in and day out by multiple means, by multiple interventions, innovations. And what we do, therefore, driving superior clinical outcomes and impacting lives at scale. So whatever we do today at Medisage, everything leads to one thing, which is reaching out to the last mile doctor, because they have to make better clinical, they have to be better at clinical decisions. Then only they'll be able to treat their patients better, right? And we know that the government has limitations. They have less access. Many of them doesn't have access to the right medical education. And therefore, be a facilitator in this very important journey. Government is doing its job. Private players has to, play a very, very important role in taking this concept forward, wherein we try to educate the last mile doctor, irrespective of where he's sitting in. Therefore, this 70 people activation in UP was done with that objective in mind. Why? UP being the largest, state in terms of population, but the number of doctors are not, the highest. It's kind of, 17th or 18th in terms of number of doctors. That means the burden on a doctor is too high. He gets less time per patient. And therefore, if he doesn't has the right education, he will not be able to impart the best knowledge. He will not be able to treat his patients, better. And therefore, imparting the right knowledge through multiple means by giving him an omnichannel experience is the motto of Medisage, right? As you can see, in this, what I have shown you in the right side of the slide, we do multiple things, we make them part of webinars, we make them part of Mediflix, like, small video series. We ask them to post their cases in this application, which is Medisage. They can learn from other cases. They can remain connected with, other super specialties and specialties. Okay. They can ask a question which is troubling them, right? They can, go through all the journals we have provided them access to. Around 3,000 journals we provide them access to. They can create their own groups. They can interact within their own groups. So all virtual solutions we provide to them, right? Plus, we also have people who call on them to impart some, important information to them. That is how we try to provide a very omni-channel, experience to the doctors community we engage with day in and day out. We also go to medical colleges. For students, we have a different kind of offering. For everybody, we have different offering. Now, all these are very scientific in nature. Will the normal graduates will be able to do? Will they be able to do conversations with the HCP community at the same level? We had our own doubts. Therefore, we have recruited all pharmacy graduates into this role. We have multiple roles, when it comes to our office. We have multiple offices. Now, again, not only being a part of, this interaction with the HCP community, but somebody can do medical writing. that, anybody who is very inquisitive, very creative can come into medical writing, okay, content writing. Somebody who is into kind of analytics can join data analytics team, okay. Somebody is into project management, he can come as a project management. So these health tech, organizations of today's has multiple things to offer to people, pharmacy graduates like you, or would be pharmacy graduates like you. Therefore, it's a very, very interesting space that you are going to be part of. This is the health tech ecosystem that we have created at Medisage. And I wanted you to be sensitive towards that. Just see how many things we do. Just by saying that I go to a doctor and, do some interaction won't help. If I want to give them a complete, 360-degree experience, there are multiple things that we have to do. So as you can see here, we do academics for the UG and PG community within medical colleges. We interact with the government, center, and state to do knowledge dissemination activities with the doctors community. We engage with non-governments, organizations, semi-government organizations like, Public Health Foundation of India. We engage with hospitals. We do their virtual programs on knowledge dissemination. We, interact with governments, and we also have our examination portals where UG PG can, write exams. We collaborate with a lot of experts, key opinion leaders across India, so that they provide us the right content to educate the entire HCP community. We go for, academia. We, connect with them globally from all across the globe. All these multiple things, we do. Then there is one very important thing called associations, like for healthcare association organization that I was mentioning, HCO. So we have Indian Medical Association, Indian Academy of Pediatrics, multiple things like that. We go and interact with them so that we can impact the HCP community. And again, we require, pharmacy graduates to take all these things forward, right? We do accreditation of doctors throughout the initiatives that we have. This also we do along with Medical Council of India and the state medical councils. So a very comprehensive kind of approach, whereas 360-degree interventions, very innovative solutions are provided to the HCP community. That is how we upscale them so that they are able to treat the patients better. Now, when graduates like you or would-be graduates like you associate themselves either with pharma company, with health tech company, to do sales and marketing, to do multiple things that I have discussed, this all space you can become part of, plus the all other things that I showed you. So friends, you are just starting such a wonderful career, and multiple things you can do, multiple ways you can impact the society. It's such a wonderful thing to be in. If time allows me to go back, when I did my post-graduation, of course, that was very, very good and I enjoyed. That is why I taught my college. But if I am given a chance to go back, and do it again, I would like to do my BPharm and MPharm as well, because then I would have been able to contribute what I'm contributing much earlier in my career. Next slide, Dr. Kumar. So again, this is just a glimpse of what all we have been doing, live CMEs and conferences, Netflix kind of series, accredited courses, other engagement formats. Okay, so we are a resource for health information to the doctors community. That is what we do day in and day out, right? We have this platform. Some of you can, download Medisage if you wish, and you can see all the things that we do. And we are very, very proud of that. It's a 6 lakh strong HCP community that we have created at Medisage. Next slide, Dr. Kumar.
Yes, sir.
So if I have to summarize, all the things that I have said, again, it's not about, taking notes. It's about internalizing. It's about sensitizing yourself. Start thinking of the journey, and that's the most important thing, and where you can intervene. So friends, after all, it's you, it's your life, it's your profession, and you only will have to chalk out the career that you would like to be in. So understanding yourself is the key. You got to know what you are good at, what your natural orientation is, what are your strengths. You have to understand the ecosystem around you. You understand your family, you understand the society that you belong to. You understand the ecosystem that you would like to work for, because you also can do Google search, you can go and visit those places. One important thing might be have the right mentor, because at times you want the right advice. And I think what Dr. Kumud and team has organized today here is maybe part of that only. They are trying to sensitize you so that you all have the right mentor, you all take the right decisions, and be a solution provider. See the gaps that exist in the society, in the community. Can you provide a solution? When you start thinking about providing solutions, I know you can have plenty of innovative solutions, and those kind of people only become successful going forward in their career. Yeah. So friends, I mean,
Yes, sir.
next slide, Dr. Pramod.
Yes, sir.
So good start is half the job done, and the decision in front of you, you have to make that decision. You have to embark on a life which is, so positive, which is so fulfilling, because it has the potential to impact lives at scale. Just imagine, all these patients will be benefited because of your interventions. It's a wonderful thing to happen. So I wish you all the very best in whatever you do. I am sure you will take the right decision by sensitizing yourself adequately. Thank you all. And now I think, I'll be open to Q&A if at all you have.
Yeah.
You can have my number. You can connect with me at any point of time.
Sir,
Yeah.
sir, this is Dr. Chitra.
Yeah, Dr. Chitra.
There are a number of questions in the chat box. I think Dr. Kumud would like to take them up. The first question that we see is what is the difference between D-Pharm and M-Pharm, right? Avinash sir, I think we would address that probably.
Exactly.
Yeah. D-Pharm and B-Pharm, yes. So students, D-Pharm is just diploma in pharmacy. It is a 2-year course. And B-Pharm is a graduation program which is of 4 years duration, right? And after D-Pharm, maybe you can open up a chemist shop. But after doing your B-Pharm, a wide variety of platforms will be open for you. You can take up government jobs also. You can take up analyst jobs. You can go further for higher education, your M-Pharmacy, PhD, and you can take up several other jobs. So, I think I addressed it. The next question, Dr. Kumud, would you like to take up?
It's okay, ma'am. Please carry on.
Okay. The next question, I think let's ask the students to join by their names. Hai na? Can a pharmacist open a clinic? Can a pharmacist open a clinic? So recently, this has been permitted by Government of India in some urban areas. Urban areas, you can practice with reservations your medical practice. You can take up medical practice, but with some reservations. Then there is a question from Sujata Maurya. Pharmacy में admission कैसे ले सकते हैं? So Sujata, it just requires a 10+2 degree with science, and you can take admission in pharmacy. You should be a 12th class pass out with science subjects.
मैम अगर एक्चुअली हम ग्रेजुएशन बीएससी कर ले रहे हैं तो फिर
ग्रेजुएशन बीएससी कर रहे हैं ऑलरेडी? हाँ,
मैं ग्रेजुएशन कर रही हूँ।
हाँ, तो भी बीएससी कर रहे हैं ना आपके पास?
2023 में मैं फाइनल हो जाएगा।
आपका बीएससी हो जाएगा। फिर भी आप फार्मेसी अगर करना चाहें तो कर सकते हैं। There is no age limit to it as such, ठीक है? तो बीएससी के भी काफी बच्चे B-Pharm, हाँ जी।
कोई कॉलेज रिक्वायरमेंट, उसकी फीस एनुअल कितना होगी?
फीस स्ट्रक्चर बेटा गवर्नमेंट द्वारा डिफरेंट कॉलेजेस में डिफरेंट है। गवर्नमेंट कॉलेजेस में थोड़ा कम है और प्राइवेट कॉलेजेस में ज्यादा है। यू नीड टू फाइंड आउट फ्रॉम द इंडिविजुअल कॉलेजेस।
Sujata, there are numbers given of the admission counselors on the creative. आप वहाँ पे बेटा personally contact कर सकते हैं, ठीक है?
कहाँ पे मैम?
आपने जहाँ से क्रिएटिव का लिंक लिया ना बच्चे मीटिंग ज्वाइन करने के लिए, साथ में क्रिएटिव था ना?
यस यस,
ठीक है। So
वहाँ
उसी
पे
में
एडमिशन कमेटी की नंबर है।
Ma'am, I suppose you may take the next question.
This is about recession. Good morning, sir. Nowadays, intellectuals are discussing about recession in IT sector, whether this recession in IT sector affects our pharma profession. So, sir, Avinash, sir, I think you can better answer that whether the
So,
pharma profession is
sure.
affected by recession.
Sure. So yes, it has been impacted, a lot. And of course, it has been impacted in a very positive way because everything has gone up. So friends, like I said, the three core things, which is patients. Patients are always going to be more and more. Doctors always going to be less and less. Drugs always will remain less. And therefore, innovative solutions will always be required. Reach out will be required. Accessibility, affordability will be required. And till that time, further innovative solutions will be required. This can never be relevant, not in 100, not in 1000 years. So this is one sector. Irrespective of what happens to IT, IT health is always going to flourish.
Very true, sir. And now that we have more avenues adding on to it, it's not only about drugs, it's about nutraceuticals as well. So Vision 2047 states that it's from illness to wellness now.
Illness to wellness, absolutely.
Yeah, so I think we have a better stake.
And if somebody wants to provide a complete, omnichannel intervention in illness to wellness, then there is no end to it.
Yes, very true, very true. One more questions that is from Yanshu. Probably she is already graduating from somewhere or graduated, and she wants to ask, what will be the best like doing job right after your graduation in these fields as to gain experience, or we can go directly for our higher education for better experience and outcomes? What should we choose? Sir, I would like you to address that.
Okay. So, see, like I said, your inner call is the most important thing. Now, when I was activating this entire UP team, we asked many of them, those who have completed B Pharma and in their college M Pharma is there. What is your inner calling? Would you like to go into research? Would you like to do, when they said yes, they had an answer that yes, let me, complete my M Pharma first. Some of them, because of the ecosystem that they were part of, I mean, their family background and things like that, they wanted to do a job. So what exactly you want to do? If earning money is that important after B Pharmacy, you can come into these things. But if research and, higher education and all those things are what the field that you would like to travel, then of course you have to go for higher education and pharma and things like that you have to do. So it's your inner calling. You have to understand the space. There is no answer that you have to do this first and you have to wait. No, it's your call only. You have to sensitize yourself about what is right for you.
The next question from Pankaj, is it really important to do internships during the course?
I think we encourage it a lot. Some 15 interns are there working with Medisage, and we have taken them from top, pharmacy colleges, and we expose them to multiple, skills. Their own version is, that it is really helping them be a complete professional, and they look forward to, completing this 4-month internship thing. So I think it's a very, very welcome thing. It sensitizes you towards multiple things that will be requiring. It helps you understand your orientation, which is very, very important. Some of that may give you answer whether you should be going for a higher course or you should be doing a role, a different kind of a role.
I think, Pankaj, you got your answer. That internships are a very important component, because you learn from books in the college, then at internships you really get a workflow experience, and that really helps you identify in which role you can find yourself best suited, what sounds most interesting to you, and accordingly choose your career path. So Kumud ma'am, I think we have time limit, and let's end the question answer session here also.
Sure, ma'am. I would request Chitra ma'am to kindly, thanks to our today's speaker, Avinash sir.
Yes, indeed, it's an opportunity to be thanking him. So, Avinash sir, thank you very much. It was quite an insightful and inspirational session, and indeed very thought-provoking for students. A few points that you have mentioned in your talk and that I would also like to reiterate is that pharmacy is a diversified field and students have endless directions to go. You can start from anywhere and land up anywhere. There are no boundaries. Boundaries सिर्फ होती है जो हम अपने दिमाग में अपने लिए बना लेते हैं. And where you reach depends on your skill sets and unique selling points you develop for yourself during the course. And mind you, it is there in pharmacist oath also that we all ought to be lifelong learners. Maybe in any profession, I think it is applicable to all aspects of life that we should be lifelong learners and learning should not stop. Try and find innovative solutions to societal problems. And out of box solutions to common problems makes what is known as innovations these days. So innovation is nothing but just a solution that you find to a problem, common problem. And one most important point that Avinash sir mentioned and which sounded most interesting to me was that research is an integral component of every job. Please mind that research is nothing like doing something in a highly sophisticated lab or carrying a tag of an R&D scientist. You can put in research in every aspect or in every job you do. It is all about just intriguing what you are doing, finding out the causes, finding out the gaps, finding out solutions to those gaps, analyzing those problems and analyzing the solutions and the outcomes you get with those solutions and improvising things. So it is a myth that research only happens in sophisticated laboratories. You can make your profession as interesting as you can by your involvement. So I think Mr. Avinash did quite justice to the talk and made you really rather aspired you a lot for pharmacy profession, for taking up pharmacy profession. And as sir said, sky is the limit where you can reach. You did not put boundaries to yourself. Just keep on learning, keep on exploring, gaining new experiences. As he said, omni-channel experience, right? And just grow. That is all we have for you today. So thank you once again, Avinash sir. It was quite eye-opening the way Medisage is going ahead and the various fields you are working into. We will try to be associated in future with you, and wishing all the good luck to our students also and a happy learning experience to everyone. So that's all from my side. Thank you very much, Avinash sir.
Thank you so much. Thank you so much for this opportunity. Have a great day.